I think Pickens County is unique in that it's a mountain community, and there were no big industries here, so people lived off the land that they lived on. And they have many health needs, and it all began when Holy Family Episcopal Church had a food pantry there. And the lady that was running it decided that she would just ask about their health, because she was a nurse and she thought that they looked so malnutritioned and run down and no smiles and that kind of thing. And she started asking, and 100% of them that came to the food pantry every week had never had any kind of health care at all. This prompted several of the doctors in that church to start thinking about a health center here in Pickens County. Dr. Hallam spoke to us as a guild, as a member of the guild, and there were like 150 or 200 ladies there. And I just loved what he said in helping people, and that you did not have to have a medical degree to work here. That, you know, if you could just say good morning to people, that was enough. And I cornered him after he spoke, and I said, I'm Jobeth Yarbrough, and I'm interested in volunteering. I do not have a medical background, but I sure can say good morning and smile, and that we're glad to see you today. The county only has 30-something thousand as population, and it was about half of that needed medical attention. It seemed like in the very beginning, I took on the role of Director of Volunteers, and that this was my baby, and I needed to get started really fast.
Jobeth and I have both been here a long time, and anytime you have a problem, that's where you go. She thinks things through. She's an excellent problem solver. If you have a patient that you really aren't certain what you're supposed to do for that patient, then she's the first person that we go to.
Partly because Jobeth means so much to me, and to Good Samaritan. And I guess that's part of why she means so much to me, is that Good Samaritan's extremely important to me, and we just wouldn't be here without Jobeth. If she hadn't been part of that really courageous group of founders who saw a seemingly impossible situation and yet said, well, we can fix this anyway, and just dove right in, we never could have opened. We certainly never could have existed for 12 years serving the thousands of people we've served without the hundreds and hundreds and hundreds of hours that Jobeth has put into recruiting volunteers, training volunteers, retaining volunteers, and treating them always with such respect that they love to come to work.
Well, we have 32 areas that we use volunteers in. It was just amazing how many people wanted to give back that time and that energy that it takes to volunteer. When we first opened our doors and announced that date, we just didn't know what to expect. The center has grown along with the county and the city of Jasper, starting from 1 in 2002. In 2012, we had over 14,000 visits from patients, and we had over 15,000 prescriptions that were filled in our pharmacy, and over 300 x-rays were done in our x-ray department. We're probably the only county that can say everyone has access to medical care. I do this as a volunteer because I've always volunteered all my life, from mother She taught me as a teenager, and she had me sit with an elderly cousin in her dying days, and I thought, Mother, this lady might die while I'm there, and I was not very excited about that. But that taught me that there was a need for others to care about each other. And then when this opened up, I was so excited about offering health care to some people that have never had health care. And this was just a godsend to me to be able to be a part of this. And then it's not only helping patients that come here, it's helping the volunteers are helped by coming here too.